Good morning from the Oklahoma Insurance Department. My name is Rachel Fan, and I work in the Communications Division here at OID. Thank you for joining us for our Medicare Mondays webinar series. For your awareness, I do want to mention that this webinar is being recorded. Before we get started, I wanted to share a little bit about what the Oklahoma Insurance Department, or OID, does. OID is a state agency, and we are responsible for regulating the insurance market and enforcing the insurance-related laws of the state. We have an entire team devoted to protecting consumers by providing them with accurate information and timely assistance. We can also deal with your insurance company if you can't reach an agreement regarding a claim. If you would like to reach out to us for help, or if you have any questions, you can call us toll free at 1-800-522-0071, and you can also visit our website at oid.ok.gov. For today's webinar, you will be able to see and hear us. However, we cannot see or hear you. If you have a question, please type it in the chat. At the bottom of your screen, you will see several options, one of those being chat. And if you click on that, you can type your question there. We will save time to answer questions at the end of the webinar. Now I'd like to introduce our speaker, Ray Walker. Ray is the Divisional Director for the Medicare Assistance Program at the Oklahoma Insurance Department. Mr. Walker has over 20 years of experience working in and around the healthcare industry, primarily in insurance, and has had the privilege of speaking to groups across the state and around the country. Ray, over to you.
Thank you very much, Rachel. Good morning, everybody. Glad you could join us today for our Medicare Mondays. We are always glad that we can bring this information to you, and we hope you find it very, very helpful. Always want to remind folks that we're able to do this for you through the grants that are provided to us through the federal government. These are grants that allow us to bring information to you about Medicare. What is Medicare? How does Medicare work? How do you protect yourself from Medicare fraud? And what programs are out there to help people who may be struggling income-wise to make sure that they can get their prescription medications and the care that they need and stuff. So please take advantage of those things and reach out to us if there's any information that we can help you with. So we're happy to be able to do this for you, and we hope you find this information very, very helpful. So before we get started on our main topic today, though, I do want to spend a couple of minutes talking about the fraud problem. We have got a lot of reports that are coming in right now related to Medicare fraud, specifically talking about durable medical equipment, things like knee braces and urinary catheters, things like that that are popping up on people's Medicare summary notices and their explanation of benefits. And these are things that in most cases, these people aren't even using. They don't use these urinary catheters. They don't have a medical condition that requires them to use them. But the charges for these things are popping up on their Medicare summary notices. And what the bad guys are hoping is that people aren't paying attention. And I'm just as guilty as the next person. When I get a lot of these things in the mail, and I get a ton of stuff, I've turned 65. I get all the same junk mail as most everybody else. And I have a tendency to put things aside and I'll open it later, or I'm just going to throw it in the trash or whatever. And I don't pay attention sometimes. And that can be a very dangerous thing to do, folks. We really need to look at some of this stuff because there could be information in there that could clue us in that somebody might have personal information about us that they're using to commit fraud. And in the case of our Medicare summary notices and our explanation of benefits from our insurance companies, that can be very, very, very important. In the case of our Medicare summary notices, that document indicates every single claim that has been received by Medicare on your behalf from any providers, whether they're factual or not. In most cases, we hope it's actual providers that you've seen that have rendered services to you for the health care that you've received. But unfortunately, sometimes the bad guys get your information and they will fake claims. They'll send dummy claims to Medicare, And they'll claim that they provided you with healthcare services, or that they provided you with a wheelchair or with urinary catheters or something like that, and they'll bill Medicare. Keep in mind, Medicare doesn't know whether it's real or not. They assume if they got a claim that you received those services. So they rely on us as beneficiaries to report anything that is wrong, whether it you didn't go to the doctor that day, or you didn't get that surgery, or you didn't have cancer, or you don't use urinary catheters. So it's very important that we as consumers take the time to review any of those claims, to report anything that doesn't look correct. So please look at those Medicare summary notices, look at the explanation of benefits, look at any of those records. And if you see something that doesn't look right, you need to report that. We've got people that are finding thousands and thousands and thousands of dollars worth of charges on their Medicare summary notices that need to be reported so that Medicare can make corrections to your healthcare records to show that one, you don't use urinary catheters. It's very important that we keep your medical records correct. So we want to make sure that that gets reported. Also, we've got to protect the Medicare trust fund. There's only so much money that can be in that Medicare trust fund, and there's more and more seniors every single day. So please help us keep that information correct. Report that information. You can call us at the same phone number you call us when you're asking questions about your Part D prescription drug plan. That same 1-800-763-2828 will get you to somebody that you can talk to about fraud as well. So please do give us a call. All right, so now we're going to move into our topic for today, which is talking about keeping on top of your health. And we're talking about preventive health services and keeping yourself healthy. This is a quote that most of us have heard probably at some point in our life. An ounce of prevention is worth a pound of cure. That came from Benjamin Franklin in 1735. Something that you might not be aware of, in 1735, when Benjamin Franklin made this quote, he was only 29 years old. But guess what? Benjamin Franklin lived to be like 84 years old. Now, why is that important? In 1735, folks, most people weren't living to be 84 years old. All right. Life expectancy was like in the 40s. So for somebody to live to be 84, that must have been a really good quote to keep in mind. So apparently, prevention is a really good idea. Okay. So we want to make sure that you're taking the time to not just go to the doctor when you're sick. All right. We want you to be taking those steps to keep yourself healthy. Medicare is a great thing to have for when you get sick, but it's also now a really awesome thing to have to keep you healthy before you get sick. When Medicare first started, it was only there for when you got sick. Medicare in the beginning didn't cover preventive services. Okay. It's only been probably within the last decade that Medicare started covering preventive services. All right. So this has been a really great advance in medical care. When you think about preventive services, these are the things that are there to keep you from getting sick. Okay, those things like vaccines and things like that. It's there also to keep you healthy by detecting any medical conditions that might be there in their earliest stages. When you think about some of those medical conditions, if you catch them when they're just starting, they're so much easier to treat. They're so much easier to get rid of, and to remove and stuff. Think in terms of cancer. Once a tumor is much, much larger, it impacts other organs and other systems in your body, and it can spread to other organs in your body. Whereas if you catch it in its very earliest stages, you don't have that situation. The other thing to keep in mind, unfortunately, folks, as we get older, our bodies don't just bounce back from being sick as quickly as it does when we're younger. So again, catching things when we're younger, when they're in their earliest stages, our bodies don't have to fight to get back to where we were before as much as they did before. So again, taking advantage of these preventive services can really be such a great thing to keep you healthy. And a lot of these things are covered at 100%. And these aren't just things for physical health. A lot of these impact our mental health. We've learned, thank goodness, finally, that a lot of what has to do with our physical health applies to our mental health. Keeping ourselves mentally healthy applies directly to our physical health. And a lot of that has to do with remaining social. We have a bad habit when we get older of isolating ourselves and not getting out there and remaining connected to society and staying connected to our friends and developing new relationships and stuff. And it's important that we maintain our mental health just as well as our physical health. So there's a lot of those screenings and things that are now covered by Medicare that relate to that and help us get engaged in maintaining both our physical as well as our mental health. Now, when we're talking about these preventive services, you want to make sure that you understand this isn't just if you're on traditional Medicare. If you're on a Medicare Advantage plan, you also have access to those same preventive services. It's going to be important that if you're on a Medicare Advantage plan, that you understand you do have to see those providers that are contracted with your Medicare Advantage plan, but you have access to the exact same preventive services. Now, again, like we said, why are these things important? One, early detection. The earlier you can detect some of these conditions, they're much easier to treat. Recovery is so much better. Outcomes are much more improved. Cost savings. It's in many cases, it's much easier to treat something, much more cost effective in the earlier stages. It's again talking about the Medicare Trust Fund. A lot of times it's less costly to treat something in its earliest stages. So we're not having to spend so much out of that Medicare Trust Fund, talking big picture here, when we can get something done in its earliest stages. So taking advantage of those preventive services can mean something down the road in terms of trying to maintain the Medicare system in the long run. Now, talking about the cost for preventive services, the other thing that made getting these preventive services covered so important was the fact that recognizing that we needed to get them covered at 100% because, money is tight when you're a senior. We're not getting raises like we did whenever we were in the workforce. And so, excuse me. So we wanted to encourage people to take advantage of these preventive services and make sure that they were utilizing these. So any of the preventive services that are recommended by the U.S. Preventive Services Task Force are covered at 100% of the Medicare approved amount. Okay, so that means that for those preventive services that you qualify for, now there's certain qualifications, uh, mammograms, colonoscopies, all of these tests, they have certain requirements. Like at a certain age, a person should have a mammogram or a colonoscopy, bone density study, whatever the case may be, so often at such and such age, that sort of a requirement. And if you meet that criteria, then it's covered at 100%. So you want to make sure that you talk to your doctor and they've got that criteria, that computer that they set in front of every time you go in and see the doctor. They can pull that information up and they can tell you exactly which of these preventive services that you need to get and how often and whether or not you qualify to get those done. And they can help you get those scheduled so that you make sure that you stay on top of those preventive services and you're getting them done when you need to. Now, and again, whether we're talking about Medicare Advantage or straight Medicare, both of those, they're covered. So please make sure you're taking advantage of that. Now, there are going to be some times when let's say that you're getting, I'm going to use a colonoscopy just simply because that's one of those things. Nobody likes to get a colonoscopy, but they are very, very, very important. because they can find out some very, very, very important information for you. They are covered at 100%. If you're getting a screening colonoscopy, you've never had a problem before, you've never had any issues as far as colon cancer or anything like that, and you probably never even had a colonoscopy before, and your doctor says you need to have a screening colonoscopy. And so they get one scheduled, and let's say you go in. And let's just say that the person that's performing the colonoscopy finds what they call a polyp, some kind of growth or something. At that moment, while they are doing the colonoscopy, your colonoscopy is no longer going to be considered a screening colonoscopy. It's going to be considered diagnostic because they've now found something. And in a way, that's a good thing because now they can remove that polyp and they can test it. They can see, is there something serious here? Is there a problem? They can remove it to keep it from growing and possibly becoming a problem. And they can begin researching, finding out, is there something that they need to do? Are there other polyps? This is one of the reasons why you're getting a screening colonoscopy. We want, as we said before, to find these things in their earliest stages. So your screening colonoscopy has now become a diagnostic colonoscopy. It's no longer covered at 100%. It's still covered, but it's going to be covered like a diagnostic colonoscopy at 80% of the Medicare covered rate. So it would be covered by other insurance. Let's say you've got a Medicare supplement plan. So Medicare is going to cover 80%. Your supplement might pick up the difference. Or if you're on a Medicare Advantage plan, it would be covered however your Medicare Advantage plan would cover it. So it's still covered, but it's not covered at that 100%. The other good news is there was a problem that they have found now and they can be treated. So it served its purpose. You went in, you found something at its earliest stages, and now hopefully they can treat it and get you well again. That's the purpose behind covering these preventive services. We want to keep you healthy. So the same thing would be true for, say, a mammogram. Maybe you've never had a problem before. You've never had a suspicious mammogram. They've never found any lumps or anything. But suddenly now they find something on a mammogram. That mammogram would no longer be considered a screening mammogram. It would be considered diagnostic. So just be aware if they find something, it might be necessary for that to become a diagnostic procedure. The good news is it is still covered. And also, now we found something and we can treat you and try and keep you healthy. All right. Another thing that I want to make sure that people are aware of is sometimes we get our terminology a little twisted around. One of the things that's covered by Medicare at 100% is the Welcome to Medicare visit. And then if you're not new to Medicare, maybe this is something that you're getting done every year because you've been on Medicare for a while, is the annual wellness visit. This is not what most of us think of as a full-blown physical. We see things on TV where they're getting like they're in the paper gown and they get their blood drawn and x-rays and all this other stuff. And that's really more of a physical. That's a full-blown physical. And a lot of times, because of ongoing health conditions that we as seniors sometimes have, that's what a doctor has us go through because we do have health conditions. We've got things that the doctors know about: hypertension, cholesterol, kidney problems. The list goes on and on. But if we're a healthy senior, like many of us are nowadays, we can get by with what they call an annual wellness visit. It's pretty much just a visit. They'll check your height, your weight, your blood pressure. They'll, listen to your chest and they'll talk to you. They'll ask you, how are things going? They'll ask you a list of questions. They'll ask you if you're having trouble getting around and things like that. It's more of a conversation with you to see, how is it? Are you doing okay? You having any problems with depression? Anything like that? What they want to do is assess, are there any things that you do need? When's the last time you had a mammogram? When's the last time you had a colonoscopy? Has anything happened during the past year? Have you lost any loved ones? They want to assess what are the things that are going on in your life and do we need to get any additional tests run? So they may not do any blood work or anything like that unless you indicate that there's something that's going on that might mean that they need to do something like that. So don't expect that an annual wellness visit will include some of these other tests unless you give them any indication that it might need that. Now, vaccines are another part of this whole important wellness protection thing, because these are some of the things that over the years have helped keep us all safe. Now, in some situations, vaccines are covered by Part B, and in other situations, they're covered by Part D, as in dog. That's that Part D of Medicare that's a separate part. It's the newest part of Medicare. It's only been around, what, 10 years, 15 years, 20? No, goodness gracious, now it's almost been 15, 17 years. I'm feeling my age right now, folks. But anyway, some of the vaccines are covered by Part B. Those include the flu vaccine, which is a shot you need to be getting every year, folks. We all hear about it. You can get it at your pharmacy. The pneumonia shot, that's one that you need to discuss with your doctor. Find out, what shots you've had, what shots you might need. Hepatitis B is also another one of those shots that's available. Not everyone needs to get a Hep B shot, but again, you can talk to your doctor to see if you're one of those people that's at risk and might need to get one. Also covered by Part B is the COVID-19 vaccine. Also, those shots that we're used to getting, we used to get them a whole lot more when we were kids because we were stupid and we were out there stepping on nails and picking up animals that we shouldn't pick up, like skunks and things like that, and getting bit by rabid animals and things. Those kind of shots are also covered by Part B. Other vaccinations, though, that are commercially available are covered by Part D, as in dog. Also, if you're one of those people that's on a Medicare Advantage plan that covers your pharmacy costs, that would be by your Part C Medicare Advantage plan. That's going to include like your shingles vaccine, RSV, and Tdap. Those vaccines are going to be covered by your Part D. Now, as far as some of the tests that we've talked about, there's a whole laundry list of preventive services that are available to be covered, folks. And you need to go out there and look at it. You could Google Medicare preventive services if you want to see the whole list and what are the criteria as far as your age and how often you should get it done and that sort of thing. But the cancer screenings, as far as mammography, colonoscopy, pap tests, all that stuff, diabetes screenings, as well as diabetes education, bone mass measurement, cardiovascular disease, that annual wellness that we talked about. This website on Medicare.gov, that preventive screening services website that I talked about, has got a lot of really good information about the annual wellness screening. I also want to put in another plug for Medicare.gov. That's the website that you can go to and you can create your own account on Medicare.gov by putting in a username and a password. And by having that website, by having that account on that website, you can keep track of your preventive services and it'll help remind you of when it's time for you to get another one of those, whatever test it is. But folks, that's also a great way to keep track of your claims information. Earlier I mentioned about the Medicare summary notices and how you need to be watching that for any of those fraudulent charges. Well, folks, like we talked about, the Medicare summary notice is where you're going to see those charges. Guess what? The Medicare folks have just started sending those out every 6 months. They used to do it quarterly. They're not doing that anymore. I don't know why. I think it has to do with saving on paper. Now they're only going to be sending those out every 6 months. So that means you're not going to see those fraudulent charges as often as you did before. Some of the people that are reporting some of these fraudulent charges to us right now, uh, some of the fraud charges that they're seeing were from April a year ago, but they're just now seeing those charges. If you've got one of these Medicare.gov accounts, you will actually see your charges in real time. As soon as CMS processes a claim, you can see those charges. So I encourage you, if you're someone that's comfortable using a computer and having an account like this online, look into setting up that Medicare.gov account. It's a great way for you to keep track of all of your stuff related to your Medicare. And then, as always, have a relationship with your doctor, guys. Don't just set up an account and say, okay, I've got a doctor. If I get sick, I can go in. You should know who your doctor is. And more importantly, your doctor should know you. So get that set up. Nothing surprises me more than whenever somebody says, I went to go see my doctor, and it turns out that they retired 5 years ago. You should know who your doctor is, and you should have a relationship with that doctor, and they need to know who you are. This is a great booklet, folks. It's available to you. You can actually view it online. You can literally Google your guide to Medicare preventive services, or if you prefer to have a paper copy, call 1-800-Medicare and they will mail you a paper copy of this booklet. It's got all the information you need to know about all the preventive services that are covered by your Medicare, whether it's related to your physical care, your mental health coverage, all of that stuff. But this is a really great booklet. I like the guy that they put on the cover this year much better than the guy that was on there last year. The guy that was on there last year looked mean to me, but this guy looks very friendly and looks like he's a nice guy. These are the agencies with whom we contract around the state that can answer questions for you. If you want to call us at our office, you're always welcome to do so. But if you're somebody that lives somewhere else in the state of Oklahoma and you'd like to talk to somebody that's closer to home, these are the agencies with whom we contract around the state to help people answer their questions about Medicare. So feel free to give one of these agencies a call and talk to them about Medicare. If you ask them a question that they don't know the answer to, they know to give us a call, and they are happy to do so. So now, does anybody have any questions that we can answer about what we've talked about today or anything else related to Medicare?
I don't see any questions in the chat. As always, you are welcome to email us if you think of a question after our webinar concludes. But yeah, no questions as of right now, Ray.
Okay. All right. So just a reminder, please, if you have not checked your Medicare summary notice, when we get off the phone, please do that. If you see anything, report it. If you're going to be around your friends anytime soon, tell them. Uh, hey, I heard on a webinar that people are committing fraud. Report it. Uh, Make sure that people are checking this stuff. Thousands and thousands and thousands of dollars are being lost to this fraudulent behavior. And I don't know why people are picking now to really come out against this, but please do that. Folks, again, I appreciate your time. I appreciate you taking the time to join us, and look forward to seeing you again next month. And I hope everybody has a great week. Thanks.